Welcome to Plugged Inland. I'm Roger Bowman. Today we're going to look at differing cultures and how they engage our modern medical system, starting with the alternative healing methods of Native Americans. From shamans to sweat lodges, traditional practices are still being used successfully. Let's begin with a story of a person who was diagnosed with cancer and turned to Native American elder Kenneth to augment her Western medical treatment.
I've had a brain tumor when I was 21 years old, and I had seen a shaman and done a lot of sweats, medicine, sweat lodge, and had medicine bags, and done a lot of spiritual healing prayers. And 6 months later, I went in for an MRI, and there was no signs of me ever having a pituitary abnormality.
We were all devastated with that, and we had gone to see doctors, and there was very little cure. You know, she had took, I think it was 2 different types of medication for that. Surgery was not yet introduced to us until a lot later, because the tumor was already growing. So through prayers again, and a lot of sage, burning sage, and you know, just praying for the best, she was healed when she went back to the doctor. The doctor actually even said that it's a miracle. He was even shocked himself. So with that, we were all, you know, miracle believers.
I was 30 years old. About 2 years ago, I was diagnosed with cancer, stage 2, and at that time, I was going to have surgery and then treatment after. So if I was to have the surgery, I would not have been able to have kids.
Like every mother, we were devastated. And I did a lot of prayers, and I burned a lot of sage. And I even went to the point that I did extremely a lot of fasting.
Well, about a couple years later, I found I was pregnant, and during that time, I seen my mother had gone to see Elder Kenneth.
The whole family was devastated, and through our prayers, we were able to hear that Elder Kenneth, who is a shaman, spiritual healer, was in town. So I quickly came, and during between the breaks, I went up to him and I explained the situation. And at that time, I had no money to even pay for a medicine bag, and he said, "No problem, I will make her a special one." And he did. And since then, you know, Shannon has been wearing it off and on, but the prayers are still with us. And I do believe in prayers quite a bit.
When they come to me, it was here at this conference, and it was in the hall. We didn't have a place to, and she came to me and said her daughter was a cancer, and I think I don't know if I gave her a medicine bag, and I told her to put it on there.
So I always wore it and prayed, and I went in to get not a biopsy but some lab tests done. My stages of cancer was nowhere as far along as it was. Being pregnant with her, her cells had helped me, as well as I believe the prayer and the bag of Elder Kenneth I had made.
You know, the Heavenly Father, our Godfather, is very powerful, and with the faith of that, the healing came, and we're very grateful.
Old days, they all wore, you know, medicine bags, but the old time ones, you know, they just used buckskin and tied that there, but I just used beads, and I made my own thing, and I put sweetgrass, cedar, and sage in it. And then I put a little piece of my medicine in there. And while I'm making it, I pray ever who this goes to help them, you know, bring in the good, take all the bad spirits away and attract the good spirits, and keep them well and safe and everything. And
No, I didn't have any normal Western treatment. I was going to. I was just healed. No, I don't have anything right now. I'm doing more lab tests for follow-up, but as of my knowledge and as of now, I don't have anything.
A miracle. She is a gift that the grandfather, which is our Heavenly Father, had given us to, not just to her, but to all of us. And that we should remember how to live and to be careful with whatever God gives us, you know, which is life.
like a lot of people ask me to come and they're having trouble with ghosts or spooks or whatever you want to call it, you know. And I'll go and I use the cedar and the sage, and I go around and kind of pray at the same time, you know, that these people don't need to, you know, that's there, just go ahead and leave them alone and go some, you know, where you're supposed to be and leave, and they leave. I don't know.
Well, I think if you believe in the faith, if you believe in healing, and you become grateful of life, then it will come to you. We just have to learn to be a little patient about it. But faith takes a big part of it.
I'm pleased to welcome to the studio a professor of history and the director of Native American Studies at UC Riverside, Dr. Clifford Trafzer. Joining Cliff is a professor of medical anthropology at UCR, Juliette McMullin. Thank you both for being here.
It's nice to be here.
Cliff, let's talk a little bit about about Elder Kenneth that we saw in the video.
Yes.
You know him, and you know the origin of his becoming a shaman.
Right.
Tell us a little about that.
Well, I first went to his vision place in the Cherokee country. It's about 5-6 years back. I was there with another native person who was introducing me to a number of shaman medicine people among the Cherokee. And we stopped off at Dwight Mission, and we stopped there at a cemetery to pray for the children who had died while attending school there. And while we were there, she says, you know, this is where Kenneth received his power down here. So we crossed the fence and went down to this creek area. And Kenneth had received his power there during a sweat lodge ceremony. Now, this was only his second sweat lodge that he had attended.
We're going to define that for our viewers here in just a moment.
All right.
So we'll just go with sweat lodge. So
all right.
good story.
And while he was down there, the other fellows who were participating went to the mission to get a bite to eat. And while he was there tending the rocks, and you have to heat the rocks, you see, that sparks flew. And they were blue sparks that he saw, and something spoke to him. And
now, this is Kenneth
Kenneth
before he
Kusawun.
was a shaman.
This is right. That's right.
And
this is where he receives his power, his medicine.
Yeah, we want to talk about that. But just to clarify, a shaman is a medicine man, as
That's
the
right.
vernacular that most people would know.
That's right.
Is a medicine man, a spiritual healer. That's a shaman.
And he would call himself a healer. He doesn't like to be called a shaman or a medicine man. He says, I just help people. But the message was that he was to pick this up, and so he did. And
The voice.
The voice
that he
told
heard.
him to pick up the piece of wood that was glowing blue, and so he picked it up and held it, and it did not burn him. And then a series of events took place. The wind blew through, a storm took place in front of him, and then he was standing there, and an earthquake took place. And he was beside himself, asking, what is going on here? And he heard the voice again say, Kenneth, I want you to do the medicine. I want you to heal people. I want you to do the sweat lodge for me. And Kenneth...
Did it shock him, or did he understand that some people that are Native Americans are in fact called this way?
He understood that, but he did not feel that he was worthy of this, that it certainly couldn't be him. This is just not part of his background. And yet he responded and said, I don't do that, I cannot do that, I have nothing to do that with. And the voice said, get a bucket and a dipper, which you use to dip in the water and put on the rocks. So after this occurred, the other fellows came back, and then he said nothing for a couple of years about this.
He just had this amazing experience. How would you choose to, let's just say, ignore or keep private about that? I would imagine that would be such a revelation.
He didn't know what to do with it. He didn't know who to trust with this. Most people would think that he was hallucinating, that he had made this up. This could not be true for him. And yet what occurred was a phone call from his daughter saying that her boyfriend, who worked at a Circle K, had been shot point blank with a .38.
Ouch.
And it had blew his liver apart, and that he was dying. And asked Kusawun, Kenneth, to come to the hospital. And he said, well, there's nothing I can do there for him. He's in good hands at the hospital. And so she begged him to come, and he said, all right, I'll come. And while he was showering, he heard that voice again saying, Kenneth, you do not know the power I've given you. Now go use it. And so he goes to the hospital. A priest is giving Jaime his last rites, and he receives a message, that's not right. He's going to make it. You tell him that you're praying for him and that he's going to make it. So he told Jaime that, called a number of his patients, because he was running a rehabilitation center, and asked them to meet him at the sweat lodge that they had created at the Fort Sill Indian School. And when they got there, numerous birds were flying about, which he took as a good sign. They went in, and he said to them, you know, I've never done this before, run a sweat lodge. I don't know really what I'm doing, but I believe that our collective prayers are stronger than my single prayer. And so they prayed for Jaime's life. So in the long run, what happened was initially Jaime got a little bit better. The doctors put his liver back together somewhat, put the blood vessels in, and said, you know, if only we could get the blood flowing. So the men met again and started praying and singing for Jaime for that blood to flow, and it started flowing sufficiently that they were able to fly Jaime to the University of Oklahoma Medical Center in Oklahoma City, and Jaime made it, and Jaime is alive today.
That's
still
great.
with us. Yeah. This was the start of Kusawun admitting that this had happened to him, and then people started coming to him asking for help, and he just feels like he helps other people as best as he can. He prays and sings for them, takes them into the sweat lodge when he can.
Cliff, you brought up so many things in the course of the one story. I'd like to chop it up a little bit and touch on some of them, one of which is, what is a sweat lodge, and do you already have to be a healer to be affiliated with them or use them or build them?
That's a difficult question, because the sweat lodge is a holy place. It's like a small church, a native church, and a place to be used in the correct manner, not to be used for commercial purposes for sure. If you're a medicine person, a healer, you do not charge people to use the sweat lodge, as we've seen other people charging many dollars to use them. So,
if you would,
so
Cliff,
a
just
sweat
give
lodge. A sweat lodge often has about 12 willows. The way it's done on the Great Plains, it's done differently in different places. But on the plains, the one that the Comanches use is they use the 12 ribs that go around. You dig a small hole and you pull these poles up, and then you tie them together. If you can imagine creating a dome.
Okay, sure.
And then you cover it thoroughly with canvas, or in the old days you would do buffalo hides and cover it. And then there is a walkway that you have in front of there, and a fire that you need, because the fire is sacred. You're heating up rocks, and inside you create an in-depth hole here, in which you take the very hot rocks and you bring them into the sweat lodge, and then you pour water on them, close it, and then you start out by praying. And there may be some beginning songs. Kusawun would sing a couple of different songs, calling songs, and you're calling on the power, the healing power, to come to this place to help these people who are in need.
I'm going to switch over to our other guest, Cliff, and we're going to get back to some more of those elements. Welcome, Juliette. Thank you for being with us.
Yeah, thank you.
You look great tonight. So let me ask, your field of study is not Native American healing.
Right.
But you have done research on two different things that I'd like to touch on and be sure to get to tonight. One is Pacific Islanders, Hawaiian cultural belief, and the other is just within our modern society, how physicians have a tendency to cluster us together, maybe even stereotype us, and then treat the stereotype, not the person, and how narrative storytelling can help overcome that barrier. And I want to get a little more on that. Let's start with the Pacific Islanders. Tell me a little bit about their story of origin, and do they derive health from it?
So some of my earlier work was with Native Hawaiians and thinking about what it meant to be healthy. How did they define a healthy Hawaiian? And in particular, how was that related to the current sovereignty movement in Native Hawaiians trying to regain control of some of the islands? And so part of that, as I was doing the work, I kept on hearing the origin story over and over again. And the importance of that really has to do with kalo, the taro plant. And I don't know if your viewers know about poi, which is...
Poi the food.
Poi the food, yes. And it is basically the smashed up taro plant. And so it's very pasty. Some people love it. I love it. Some people don't like it so much, you know, because it's pasty. But so a lot of it centers on being able to get that food. And the importance of the kalo is that it is the firstborn child of the god Vaikea and his consort. And that child was stillborn, and so it was planted into the ground. And then it grew into the kalo plant. And then after that, the Hawaiian people came. It came from the gods as well. And they see the kalo plant as their elder sibling then. So you're supposed to care for the kalo, you're supposed to care for the land because that was also created from the gods. And in turn, if you care for the kalo and you care for the land, it will care for you and your health. So there's this history, you know, of like our origin stories in Christianity or Native origin stories,
Yeah.
of respect and caring for each other. And if you don't have access to the land, so, you know, with the history of Hawaii and the increasing tourism and development and so forth, you have less access to both being able to care for the land and care for each other, as well as access to the taro, the kalo plant that sustains you. So that idea is very much wrapped up in thinking about how to be healthy, and as well as the politics.
So a tourist goes to Hawaii and they see traditional festivities and they're told, you know, poi is an important part of it, and they eat it, and it's an acquired taste, and it's a starchy root vegetable. And but the Hawaiians themselves imbue that with a lot more reverence, with a feeling, and I don't want to put words in your mouth, but that everything's alive and interconnected. Like you said, the plant itself is born of having buried the stillborn child of the gods.
Yeah, and so a lot of, well, the islands, so Papa and Vaikea created the islands as well before the kalo plant and before the elder sibling. And so all of the lands, before we were talking, I was asking Cliff about the sage that he brought, and if the Native Americans also saw that as the kino lau, which is the bodily form of the gods. And so for Native Hawaiians, a lot of the plants in the land is the kino lau. It's the bodily form of the gods.
And Juliette, with that, I'm going to use that to segue back to Cliff. Cliff, you did bring some items. Could you show them to us? Actually, hold them up.
Well, this is white sage from Southern California. It's grown locally. It's a native plant here, a very powerful plant, and it's used in smudging, as is this is sage as well from the Great Plains that Kusawun gave to me to use for people. And what you do with these two plants, as well as the red bud cedar, is that you light them, it creates smoke, and then you smudge people and you pray and you create a holy space, and you ask that the goodness come here, that the healing come here to help you. And that's like sending your prayer up to the Almighty, to the Creator.
Smoke rises, of course.
Smoke rises, of course, and so this is a holy thing. And then you do this to your body, all around it, and to the person who is ill. And for some medicine people, they can use the smoke from these to see inside you what is wrong with you.
Yes.
So some healers have that power.
Let's differentiate for a moment. There are Native American elders who don't consider themselves healers so much as just elders who are experienced with herbs, and they understand that there's some inherent property of herbs to heal.
That's right.
So they might use a variety of the herbs that are found naturally on their native lands to help heal people. And there's not so much the spiritual dimension there, although it could be augmented with prayer. And then separate from that is something that's much more powerful, and that is the spiritual healing capability.
Right. Herbal medicine was practiced by numerous people, and is practiced today by numerous people, especially elderly women have knowledge of plant medicine. But It reminds me of this plant that I didn't mention, that the creosote plant is very common in our desert here. And for some months, 5 months, I had lost my voice. As a teacher, this is pretty detrimental. And I was on an airplane trip back from a meeting up in Redding, California, and I was with Catherine Sobel, a Kauai elder who recently passed. And and Catherine says to me, when we get back to Banning, I'll cure your throat. And so we got back to her home, and I let her out. And she says, all right, now you continue down by Palm Springs, but you get off the highway and you go to the creosote plant, and you tell that creosote plant that you are having this difficulty with your throat and that you need its help. And you're asking the Almighty, the Creator, to infuse that plant with power to help you. And so I asked the plant, and I broke it off. I brought it back, and I followed her instructions and made a tea out of it that evening. Had a lot of activity in my throat. Next day, I took 2 glasses, and by the 3rd day, I could speak as I'm speaking to you now. It's a very powerful plant.
We're not talking about a laryngitis as a side effect of a flu that lasted a week. We're talking months of having lost your voice.
That's right.
You know, according to the theory of 6 degrees of separation, somebody in our audience knows somebody who in turn will know somebody that eventually will know the Google founder, Larry Page, who recently lost his voice. And that leads to, do you have to be Native American to benefit from the power of Native American healers?
No, but you have to approach the plant in a spiritual manner. Just using the plant may not necessarily help you, but it's infusing it with the spirit that the belief is that that's what will really help you. It's not just the plants. I remember my Wyandotte elder, Eleanor Siwi, said to me, I kept asking her about a number of plants, and she says, you don't get it, Cliff. It's not the plants. It's the power that's placed in the plants to do the work it needs to do.
If I didn't mention it, Larry Page has lost his voice, and that's a problem for a business CEO who has to do, like you as a professor, has to do a lot of speaking, and so far no cure found. You just mentioned this idea that it isn't so much the plant, but the releasing of the spiritual element that comes from usage of the plant. I'm reminded of Christian faiths that have similar notions. I was a Mormon practicing at some point, and we would bless oil and anoint with a healing blessing those that were sick. And we very much believed that you could heal somebody through prayer.
Yes.
And of course that came from the Almighty Creator, Heavenly Father. And it's very similar. The Native Americans believe in a Heavenly Father, do they not?
Absolutely. It reminds me of an interview I did with a Mojave elder, Reverend Swick, and who had named his daughter Matsumo, who is a spiritual character who lives on top of Abikwame, a mountain north of Needles. And I said, but you're a Christian minister, and yet you believe this Mojave way too. And he says, there's no difference. There's many paths to the Almighty, whether it's Matsumo, whether it's Mukat, whether it's God, Jesus. There are just many ways to the Spirit. And so what I'm saying about the plant medicine is that you have, it's your approach to this medicine, asking for that power to come and do this work. And that is spiritual power, and it creates the highest level of Native American medicine.
Okay, so I'm going to do a couple of things here. One, I want to remind our viewers, as a live show, you can call with your own questions, or you can tweet or email. You can go to pluggedinland.org and see how to email us just with a single click. And the second is, we're going to go to a video in a moment. And when we come out, I want to talk, Juliette, a little bit about modern cultures and using storytelling and narrative. Talking about modern cultures, a way that a lot of non-Native American people stay healthy and keep what they would perceive as spiritually as well as physically fit, is through fitness, through dance. And we have an example of that in hip-hop dance. And we're back with Professors Cliff and Juliette discussing the healing techniques of various cultures. And Juliette, I know you're a dancer.
Yes. Yes, I've done hula dancing for a while now. Hula halal, lani ola.
So is hula very physical and fitness oriented like what we just saw?
It is very physical. The fitness, you know, when we think about hula, we very much think about how to embody the song, though, the stories that are being told in the songs, you know. So when you think about hula songs, you know, some people made Little Grass Shack or whatever, but the real traditional Hawaiian songs are about their history, about their genealogy, about places, the landscape.
So hula has more importance than just entertaining tourists.
Absolutely. Absolutely, yes. So it's, you know, good hula dancers really learn how to convey the story through their movements.
Storytelling is important not only to convey cultural histories to new generations, but also in the way we interact today. You were telling me a great story about the importance of storytelling in modern times, talking to physicians,
Right.
and the importance of them listening.
Yeah, so storytelling is really, and especially when it comes to medicine, we had a conference recently, and we were talking about, you know, how stories, you need a story when you're sick. You need a story to know, you know, give you guidance on where to go. And sometimes those stories are lost when you're ill, or sometimes stories get placed on you that you don't really see as your story. So,
Ooh, tell me about that.
yeah, so for example, a Latina woman that I had interviewed about her cervical cancer, so she was diagnosed with cervical cancer, and she had a few years where she was going in for a regular pap exam. She'd always gone in, you know, annually, doing everything she thought she should be doing to be a healthy woman. So one time she was diagnosed as having an abnormal pap exam, and the doctor just gave her antibiotics. The abnormal pap cleared up. She went on her way. A few years later, same thing happens again. This time the doctor tells her, though, either you have multiple sexual partners or your husband has multiple sexual partners, and that's why your pap exam is abnormal.
Ouch, well, that would be a bombshell.
Yeah, it was. She said she went home and she actually asked her husband, you know, what's up here? Because she knew it wasn't her. And he didn't reply. And so she just kind of let the story drop there. But again, she was given antibiotics and sent on her way. It clears up. A few years later, again, so this is the third time around she's diagnosed as having an abnormal pap, and they go further this time, and it turns out to be cervical cancer. So she's getting ready to have a biopsy, and she asked the doctor, so, you know, why is it that I have cervical cancer? And he said, well, Latinas tend to get cervical cancer more, and the Anglos get breast cancer more. And she asked him, well, why is that? And he said, well, Anglos smoke more, so they're going to get breast cancer more. Latinos, on the other hand, tend to start sex at an early age and have multiple sexual partners. And that's why they have more cervical cancer.
Just categorically.
Yeah, just said that. He did,
And that calls back to the conclusion he had drawn at the last pap smear about the causation of that.
Right. Well, actually, this was a different doctor. So
Okay.
3 different doctors, too. So you see people shuffled through the system in different ways. So, yeah, no, this was a doctor the first time she'd seen him. And she said, she actually said, that's what you think of me? And he said, well, you know, this is what I've learned. And so she sent him out of the room and refused treatment from her. But she said, this is what really made me mad, is that he knew nothing about me. She said, I've been married for, you know, 8 years. Before that, I only had 1 sexual partner. I get my pap exams all the time, and he had no idea who I was. And he just said that about me, you know, basically told her that she was promiscuous, and that's why she got cervical cancer. And so she was really upset, and rightly so, you know. So here's a story, a medical story that's just placed on her, partly because she's Latina, you know, and so it makes you start questioning, thinking about what do stories do in terms of categorizing people, stereotyping them that might lead to some of the health inequalities that we see. What do people do, or what can people do to stand up for themselves or demand the story of themselves that
Be heard by a physician.
Right. But the other part of it is I don't think that physicians are really out there to stereotype and, you know, say cruel things to people, although it does happen, I'm sure, and we all have stories of that happening. But I do think that knowing and having the conversation about when these things happen is really valuable, because it allows us to say, well, how did the doctor, or ask the question, how did the doctor get to that assumption? And, you know, through all their training, they're trained, you know, the statistics, the epidemiology, the biology, and so forth. And so if you say, well, Latinas have high rates of cervical cancer, that piece is true, or in the statistics.
Yes.
And then...
And you have a Latina presented with cervical cancer, therefore,
right,
by logical conclusion, the other must be true as well.
Right, or the epidemiology of it. So it all just gets smashed together, and all of a sudden you have a really bad stereotype. So unless you take the time to sit and talk and understand who your patient is, there's so many things that could go wrong.
I'm going to jump to a couple of our viewers. One, an email question from Frida of Rialto. It says, can anyone consult with a shaman, or do you have to be a Native American?
No, anyone can consult with a shaman if that person's willing to meet with you. Like Kusawun feels like any person that asks him for help, he is obligated. He has been given this gift that he must respond and be as helpful as he can, no matter who the person is. And he's helped many people from many different cultures. But if you were to go to a Navajo medicine person, things may be different. You know, a lot depends on the medicine person and the situation.
Okay.
However, having said that, often if you know somebody who's a member of that family and they take you to meet that medicine man, well, that's different. Then you have a segue into that community. But you're the outsider, so they would deal with you differently. It depends on the person.
I would imagine that it's a lot more complex than simply saying, I want to go to the miracle cure source and have it just happen to me automatically. There's a lot of, if you're not Native American and you haven't grown up with a belief system, you'd have to be willing to learn about the belief system and learn about the spiritual side of it. You can't just receive a medicine bag and expect, you know,
miracles.
And that's the other thing I want to mention is your story, even about Elder Kenneth, and about, is it Jaime? Yeah, the
Jaime.
Shot with a .38.
That's right.
Damaged liver. Elder Kenneth did not discourage him from using Western medicine. He augmented Western medicine, kind of this idea that one is not exclusive of the other.
Absolutely. And the medicine people themselves will go to medical doctors for help. They'll go to hospitals. So, right. And what you hear from medicine men and women is that they want you to seek all the help you can get. It's on the Western side. Often they don't understand what that medicine bag is, or why you have this patch, or why you're taking this herbal medicine. You know, what is that about? That they just don't understand that. But on the other side, Native medicine people encourage you to find all the help you need. I once asked Catherine Sobel, the Kuya elder, why in the 1930s did you all allow these white field nurses into your homes? You seem to open your doors to them and allow them in. And she says, that's because they had knowledge we did not have about tuberculosis and pneumonia, and we needed to learn from them. And it was our children who were dying. So it was that simple, Cliff.
So they were willing to learn from and embrace Western medicine while at the same time not having to abandon or eschew their own ideas.
Right.
Which I think is a lesson a lot of people can learn. There's some who would say you have to go one way or the other, because if you believe in both, then you reduce the belief in one or the other. And that has validity for a lot of people, because we had a caller that asked a question, actually. Can you grow your own plants, or do you have to get them from the wild?
Well, that's you can grow your own plants, but once again, it's an issue of intent. What are you growing them for? Are you growing this white sage to sell it at a powwow? Are you growing it to help other people, to give away? So when Kusawun travels in a certain area on his way to California, and he always drives from Oklahoma, he always stops and gathers along the way. Whatever he gathers, he brings to our group and then gives it away to anyone who needs it. So if you were to grow, I have a plant of white sage at home. And so I'm not growing it for commercial purposes. I'm growing it for my own use and to share with others. And I think that medicine people would say that that's the intent.
The importance, though, to differentiate is these are not necessarily herbs that inherently contain healing properties. They are medicinal by virtue of the smudging and the spiritual element that goes into them through the prayer and through the belief system. Is that fair to say?
I believe that's right. That's correct.
So there's nothing like, it's not like sage and cedar and sweetgrass is a miracle cure that you drink as a tea and you'll be cured of cancer. Right. This is an entire intertwined. This relates to this idea of interconnectedness. Tell us about
that's right.
interconnectedness.
And the whole issue of the spirit. And the interconnectedness is also your relationship with other people, with your environment, with going to the places where you would gather white sage, giving thanks for that white sage for being there, for ask permission to take some of that, but not clearing out an entire area, but using it judiciously and caring for it. But this idea of going to places is very important too, because there are healing landscapes, as there are in Hawaii, as there are here, and that people go to these places where spirits have been placed by the Creator. My own examples recently taught to me by two Quetzan men down at Fort Yuma. They took me to this one place. It's called Muggins Peak, and they explained to me that our Creator was cremated here, and we come to this place. We spend the night here, and we ask for help if we need help in our education, if we need help in going off to the military to survive, if we need power and strength in making decisions for our family, we come to this place. But if we want medicine power, the place to go is Avikwa May, above Needles. It's a sacred mountain, and it's not a place to be approached in a willy-nilly manner. It has to be approached in the proper way. And for these Yuman people, not necessarily everyone would go to this mountain for power. There might be other power places that you might find in the desert, like the cleared circles, are power places where people have gone to pray and seek help in these sites. So our landscape is filled with these sites. Some that are very dramatic, like mountaintops, and other places not so much. Some hillside or some wash.
That has some spiritual significance.
And also healing significance for you, if that's what you need.
Let me jump over to another email. We have a question from Lamoya of Fontana. Do the Native Americans have a certain diet they recommend for good health? For instance, the Mediterranean diet.
Yeah. Well, we know that Native Americans from particular areas who traditionally for hundreds of years have eaten certain things ought to be eating those things. And it's highly recommended then for Southern California people, for example, to eat a lot of acorns, mesquite, rabbit, deer, to eat the things that are native in your diet, because eating a Western diet is harmful to you, and hence that's why we have such high diabetes rates. And that has emerged
generally
in the Native American community. It's epidemic. It's terrible.
I'm going to jump over to Juliette. Juliette, you were telling me a little bit about that same kind of epidemic amongst the Pacific Islanders.
Mm-hmm. Yeah, Native Hawaiians have, well, a lot of the Pacific Islanders, Tongans, Samoans, have really high rates of diabetes, cardiovascular disease, Native Hawaiians cancer as well. And, what's interesting about the question that the viewer asked is, for Native Hawaiians, there's been a lot of studies showing that if they do go back to the traditional diet, the poi, or the taro, the fish, the greens, that it has made a dramatic difference. So the Waianae diet has really made a dramatic difference in controlling some of the diabetes as well as
So
the
from a
weight loss.
traditional Western viewpoint, we would say, well, that's because fish is not fast food. You know, Western diet or American diet is just terrible all the way around. But Cliff, you touched on it, and I want to ask you, Juliette, if it also applies. It may be that it's a different diet than what you traditionally or your ancestors traditionally ate, and that may be the cause. Not necessarily that the diet itself is terrible, the Western diet, for instance, and going back to the traditional just creates better food, but rather it reconnects a society back to their traditional roots, spiritual roots even.
If I may, something dramatic happened in Hawaii and throughout the United States, and that was the traditional economies, the food economies of Native Americans were destroyed with during the historical period. And so the places where you used to farm or hunt and gather, they are no more. You can't get to them, and hence that created a need for food. And so on reservations, commodity foods were provided them, and it's a terrible diet, especially white flour and lard for Native Americans, and add sugar to it, and pretty soon you have a diet that's not good for the body.
Or some Westerners might say, yummy.
Yes, and some natives would say that fry bread is wonderful. You know, how could you take that? But that's not native. That's not a native diet. It comes from the commodities.
So we have a caller, and I'm going to take it from San Bernardino. Charlotte, I hope you're listening on the phone. You're on the air. What's your question?
Yes, I wanted to know, will any of those plants that he has, will it help me with my legs? Because I have these rashes that grow. Says my legs will get swollen, but then it goes down. And this rash I've been having for about 10 years.
And Charlotte?
And it's starting to go away, but I've been doctors to doctors, and they really can't pinpoint what it is.
And Charlotte, are you Native American?
Yes.
You are. Okay. So
Yes.
let's go to that. What would be her recourse?
I didn't hear all of the question.
Sure. Rash and swollen legs. For about 10 years, Western doctors haven't been able to diagnose and cure it, and she has Native American heritage.
All right. Well, for one thing, prayers have never hurt anyone, so continue the prayers, to be sure. But this was considered a miracle plant, the creosote. The desert is full of creosote, and if you were to approach the plant and ask it, what you do is you take this plant and you boil it, or put it in a tea, and then use that for your skin irritation. And I've done this with my daughter. And what I used was a coffee grinder to grind this up into into very small pieces, and then make a paste out of it, and then used it to smear it on it. So the medicine people, the herbal doctors would tell you that this is a very important plant that's worth trying. You know, will it work in your case? It might, and it's certainly worth a chance. And it's an easy plant to get out of the desert. So that would be my recommendation.
I'm going to jump over Juliette. One thing I want to make sure that we talk about this hour is how learning about storytelling and the importance of listening to the individual stories of a particular patient is so important for physicians and long ignored. And now physicians are starting to recognize that. In fact, you're even in some dialogue with medical professionals about increasing the propensity for physicians to listen to the individual stories, to find more than just their lab results on paper as background for their ailments.
Right. The conversation around narrative medicine has been on the rise the past few years. It's been around for about 30 years, but it's really taken off recently with physicians playing greater roles in wanting to understand what's going on with their story. So at Columbia University, for example, they have one of the first narrative medicine programs. One of our undergrads went there. She was one of the first classes from UCR to go to that program. I brought Mom's Cancer, which is a graphic novel about
Let me show
cancer.
This. Get it above the lower third there. This is a book.
It's a graphic novel by Brian Fees, who wrote about his mom's diagnosis with lung cancer, and then it metastasized to her brain, and just really thinking about the complications of what it means, you know, not just from her perspective going through the whole treatment for cancer, but also the struggles that the family had, and, you know, the kind of arguments that you have in families about how to help your mother get the treatment and how they came to resolution.
This graphic novel is a storytelling tool.
Yes, it is a storytelling tool, and physicians have been using it. Actually, at Penn State, Dr. Michael Green is teaching a class on graphic novels, on cartooning. So medical residents are taking a class on cartooning and how to write out their experiences with their patients or some of the things that they're feeling. So it's a way of helping them both understand the patient's story as well as understanding their thoughts about what's going on in their training and in treating patients. So, you know, this is one of the ways that I've been interested in narrative, but we're really thrilled to have the medical school at UCR just accepting its first full class for all 4 years, and that a lot of the physicians there, Paul Lyons, who's the dean for the education, is just really interested in thinking about how to use narrative in medical education. So it's great to have this conversation about what more we can do.
And Juliette's in the forefront of meeting with the medical school to encourage them. We had one meeting not so long ago, and we're going to do another one to open up this dialogue with the medical school about how to interview patients, and also to have seminars about alternative ways of dealing with people and listening and how to learn from your patient. Juliette's the leader in this.
I want to touch on that, the idea of the differentiation between Western medicine and the medicine man, shaman, spiritual medicine. But first I'm going to go to a call. We have another caller from Highland. Miguel, you're on the air. What's your question?
Yes, I'm here. I'm interested in the program, and so my question is necessary to be a native Indian from America, for the United States to learn something like that?
And Miguel, is your question, do you have to be a Native American to receive the benefits, or is your question, do you have to be a Native American to become a healer?
That's my question. It has to be some only Native American that can have the power, or everybody can learn?
Okay, good question. Thank you.
It's a good question. Well, we usually think of Native American medicine, the healers, as a gift. It's not something that you go and learn. You might learn herbal medicine, but the higher level of medicine is spiritual medicine, and that's something that's a gift given to you, and it can come to anyone to become a healer and a helper. Certainly in Latin America, there are a number of people who are curers. And they use both spiritual medicine and herbal medicine. They use massage, and they have this calling that comes to them. So I think it can come to many people. You don't have to be Native American.
I'm going to give an analogy, talking about another parallel in Christendom. Christian scientists, they fervently believe that there is the higher being, that everything's interconnected, and that you have the power between your beliefs and the higher being to align your body to the perfection of Jesus Christ. They're Christian, and as a result, be healed through prayer. And so, parallel to what you were talking about with Elder Kenneth praying in the sweat lodge, absent Jaime, who was still in use in the urgent care, the practitioners of that faith will actually pray, and they'll pray wherever they reside for somebody that resides perhaps states away. And they do believe, and in fact can show, that they have a lot of healing benefit from that. So I would offer that, and I don't want to trivialize or oversimplify either faith, but it seems to me there's the parallel where you're unlocking the calling of the higher power that has the ability to heal a person. And in this case, I know you're talking about the receptivity of somebody to healing, and that's key. somebody has to be willing to receive the benefits of an Elder Kenneth or a healer.
I believe that's right as well. There's a great deal of power that's believed to be out there, that cannot be seen. There's a lot of power that cannot be seen. There was a time when we couldn't see radio waves or television waves, right? There was a time when we didn't know about these things, but they are there. And whatever that healing power is, some people are able to capture it better than others. Everyone may be able to receive some of it, but some people have a power of receiving it and turning it into something very positive and then directing it to do the healing that needs to be done. Conversely, you can also use that power to do negative things. That we have both the positive and the negative way of using that healing power. You can do harm to others as well.
The healers, the shaman, for instance, I've heard it discussed that they use non-ordinary reality. Can you speak to that?
Well, I think it's the very thing that we're talking about, this other reality that can't be quantified. We can't see it yet. We don't know about it, but we believe it is there.
Through the calling, though, they have the ability to see a little bit of that, do they not? In other words, you were giving me the example where the healer could actually see the infirmity in the person.
That's right. Some people can use like smoke to see through it. And among Southern California medicine people, they would use their breath. There were breath doctors, and then there were sucking doctors. There were people who could use their hands to find where the problem was, and then take it out to diagnose through those means.
Is that in a brief synopsis? Is that a power they have, or is it where they are channeling almost a spirit that would indicate to them when they have found the ailment?
I think that can be the case, to be sure. I interviewed an elder on the Chemehuevi reservation, and I asked him about his grandfather's familiar. Since his grandfather was a medicine person, did he have a familiar? Did he have a power that came to him? So he was reluctant to answer at first. It took him a while, and then he thought, I'm going to tell this guy. And then he said, yes, I have seen it myself when my grandfather would call it. And I said, well, where did it live? It lived in the mountains. What was it? Well, he wouldn't tell me what it was, but others have said it is a bat.
And I'm only going to give you 15 seconds to tell me about the bat.
Well, simply that once he had a hold of it, he said, then he could do the healing and the power, but he needed that to come through him than to do it. Kusawun doesn't work that way. It happens differently for different medicine people.
And unfortunately, I can't hear how Kusawun does it because we're out of time. That's all the time we have to talk to our guests, UCR Professor Clifford Trafzer and Juliette McMullin. But I want to thank you both for being here and enlightening us on the importance of storytelling and on Native American healing practices. Next week, you are going to want to watch the show. It's a follow-up episode on the mortgage crisis. Were you able to get a loan modification? Did you lose your home unwillingly? Or perhaps you walked away intentionally when you found yourself too far upside down. Or maybe you were scammed by those who promised a modification and didn't deliver. We heard a lot of those stories. Perhaps you received a settlement check stemming from the government's recent action against the banks. Let us know during next week's show. I'm Roger Bowman. Thank you for watching Plugged Inland.